Walk into any Watson or Guardians in Malaysia and you will see an entire wall of acne products. Most of them are expensive, most of them do not work. But there are 3 specific ingredients backed by Malaysian Ministry of Health that can actually treat acne. I'm using 2 of these daily after I stopped using Accutane few years ago. These are what I often recommended to people who struggle with acne. You don't need to spend a lot of money on them and you can purchase it easily without prescription over the counter in the pharmacy. But the results? Pretty good. Hi everyone, I am Dr. Chiyen. I am a doctor practicing in Malaysia with postgraduate certificate in dermatology. If you have mild to moderate acne, those whiteheads, blackheads, and painful red bumps, these 3 ingredients are the gold standard. Let's start with number 1. The number 1 ingredient that you can buy in Malaysian pharmacy is Adapalene. Adapalene is a topical retinoid. In the past, you will need a prescription in order to buy this. Now in Malaysia, 0.1% gel is available over the counter. Why is it the best? The guideline states that topical retinoid is recommended as monotherapy in treating non-inflammatory acne such as blackheads, whiteheads, and also closed comedones. It can also use in combination with other therapies for inflammatory acne. Retinoids works by normalizing keratinization, unclogging follicles, and reducing comedone formation. To put in simple words, this means that retinoid can help to reduce the formation of acne. It treats the acne that you have and prevent the acne that you are going to have tomorrow. When you start using Adapalene, your acne might get worse for 4 to 6 weeks. This is what we call as purging phase. It is pushing everything out. Do not stop using Adapalene. Adapalene gel takes 3 to 4 months to work. So now I'm going to show you how to use Adapalene gel. Wash with a gentle cleanser, rinse and pat skin dry completely before application. Apply a thin layer over the whole face. Use only a pea-sized amount of Adapalene gel for each application. Apply the gel at night time as it is a type of retinoid and can be broken down by the sunlight. After the application of Adapalene gel, follow with a gentle non-comedogenic moisturizer to reduce the skin dryness. This can prevent the peeling and the dryness that Adapalene gel can cause. And remember, wear the sunscreen daily as retinoid can make you sensitive to the sun. Adapalene gel cannot be used in pregnancy and lactation women. Number 2 ingredient is benzoyl peroxide. Why is this ingredient important to treat the acne? The Malaysian guidelines recommended that benzoyl peroxide monotherapy or in combination should be used in the patient with mild to moderate acne. The common mistake that people make with benzoyl peroxide is people tend to buy higher percentage, which is around 10%, that cause the face to burn. My advice as a doctor is you can start with 2.5% cream. 2.5% work as well as 10% and it can reduce the peeling and redness that it causes. Apply a thin layer over the pimple or only on the oily zone. It bleaches fabric. Do not wear your favorite dark color shirts or dark towels when using this. At number 3 is salicylic acid. According to Malaysian CPG, salicylic acid is a keratolytic agent. In simple terms, it dissolves the glues that hold the dead skin cell together. This means that it can dive deep into your pore and clean out the clog. It is oil soluble. It is best for non-inflammatory acne such as blackheads and whiteheads. Look for 0.5% to 2% salicylic acid in the cleanser and use it daily on the face. Remember to moisturize your face as it can cause peeling and dryness. Who are the person that's suitable to use salicylic acid? The people with oily skin and clogged pores are recommended to use salicylic acid. However, it cannot be used to kill the bacteria of the acne. For that purpose, benzoyl peroxide is the first choice. Here is the secrets that the Malaysian guideline highlights. Use combination therapy to treat the acne. Don't just pick one. For the people who have mild to moderate acne, my recommendation is using benzoyl peroxide in the morning on the active pimple and use adapalene gel covering the whole face at night time. However, if you have a super sensitive skin that you realize that you get peeling and dry skin after you using these two ingredients, you can swap the benzoyl peroxide with salicylic acid in the morning, which is more gentle. You need to use around 8 to 12 weeks of these ingredients in order to see the result. Do not stop after using 2 weeks. This combination therapies is the method that I have been practicing for years. Whenever I have an active pimples on the face, I apply BPO cream on the active pimples. And for every single night, I'll be using Adapalene gel even when I don't have any active pimples. This method has helped to maintain my clear skin after I stopped Accutane 8 years ago. However, if your acne is cystic and is on the severe side, which means that you have tried over-the-counter product but it doesn't show any improvements, please do not hesitate to go and see a dermatologist nearby. If you are interested in my journey of clearing out my cystic acne, please check out the description box below. Thank you for watching. I hope that this video can sincerely help people who are struggling with acne. I fully understand the pain of oily skin and the struggle that you need to go through. I am always here with you. I hope that by sharing the knowledge that I have learned through my own cystic acne journey, I can help you guys who have the similar struggle as well. Bye guys!